Good afternoon, everyone. I'm Christy Moore, Chief Communications Officer here at DHEC. Would like to welcome you to our continued discussion on COVID-19 vaccine in South Carolina. Today's media briefing will feature Dr. Brandon Traxler, DHEC Interim Public Health Director, and Stephen White, DHEC Immunizations Director. Again, we'd always like to thank our media partners for sending your questions in ahead of time for the facilitated question and answer portion, and for joining today and continuing this coverage in our state. Dr. Traxler will provide an update. We'll move into facilitated questions and answers. And if there's time left, I'll open it up to the group for live questions and answers. So without further ado, Dr. Traxler, if you can, please provide today's update.
I'm muted. The theme of 2020, I suppose, is carrying on. So good afternoon, everyone. As of today, South Carolina has received a federal allocation of 142,350 Pfizer vaccines for first doses, which includes the 30,225 received just this week. 52,053 South Carolinians in phase 1A have received their first dose of the vaccine, and 1,075 have received their second dose. And 69,959 phase 1A individuals have made appointments for vaccination as of this morning. DHEC met with the governor's office on Monday afternoon to discuss concerted efforts for increasing individuals' participation in phase 1A. The CDC guidance originally provided a goal of having 70% of phase 1A individuals vaccinated before advancing to phase 1B. Over this past weekend, that guidance evolved to now suggest several variables to take into consideration for when to transition, with an overarching theme of basically supply exceeding demand. Therefore, to speed up people getting vaccinated, phase 1A individuals or their employers must contact a provider to schedule an appointment for vaccination by the January 15th, 2021 deadline to ensure priority for that vaccine.
So they have started.
Could you all mute? Sorry, so I'm going to say that again. Therefore, to speed up getting people vaccinated, phase 1A individuals or their employers must contact a provider to schedule an appointment for first dose by January 15th, 2021, that deadline to ensure priority for the vaccine. DHEC will evaluate demand up to January 15th to determine whether to then request that providers move forward with scheduling the next phase of vaccinations or remain where they are. As we work to ramp up vaccination operations across the state, it's important to understand the number of doses is still currently very limited in South Carolina, like in all states. Phase 1A individuals who are eligible in South Carolina include hundreds of thousands of people, which is much larger than the number of current doses of vaccines we have. We continue to ask people to be as patient as you can while you work to schedule that appointment to be vaccinated. Employers are encouraged to reach out to their local hospitals as soon as possible and no later than January 15th, 2021, with a list of their employees' names and email addresses who want to be vaccinated. In addition, individuals in phase 1A who want to be vaccinated should contact their local hospitals to request an appointment no later than January 15th. If there is not a hospital in your county, you should contact the nearest hospital to you. And contact information for hospitals is available and will be continuing to be updated on our website at scdhec.gov/vaxfacts. Individuals who are making appointments may need to present credentials to verify that they qualify to receive vaccination under phase 1A. And that includes providing some proof, a badge, a business card, a license or a photograph of your license, personalized letter from your employer, things such as this. to show your phase 1A qualification when presenting for the vaccination. South Carolina receives vaccines on a weekly basis. Appointments are subject to cancellation based on vaccines that are received from the federal government. Our ultimate goal is still to save South Carolinians' lives. DHEC remains dedicated, just as we have been this whole pandemic, to working with our partners to ensure in this situation that everyone who wants to be vaccinated against COVID-19 in South Carolina will receive a vaccine, but it is going to take some time. To help South Carolinians better understand when we expect the vaccine will be available to them, we've created a timeline to help walk folks through the process. Christy, do you have that timeline? Can they see it?
Give me just 1 second.
Thanks. So I will tell you, as vaccine supply increases, our recommendations for vaccination will expand to include more groups, and eventually to go through phase 2 and possibly even a phase 3.
I'm going to share my screen. Can you see that?
Yes, thank you. So this outline provides an overview of the estimated timeframes for each phase. And you can see we've started on the far left-hand side with supplies of vaccines started shipping December 13th to South Carolina. We received weekly shipments. You can see there the providers and when they did or will receive vaccine. Phase 1A in South Carolina started December 14th. We're currently in that phase. In early winter, we will expect the phase 1A to continue again to late January or February of 2021. In late winter, phase 1B will include the groups of people that are age 75 and older, regardless of whether they have any underlying health conditions or not, and those frontline essential workers. And those sectors that have been identified by the CDC's Advisory Council, Committee on Immunization Practices, ACIP, include firefighters and law enforcement officers and correction officers who were not included in phase 1A, food and agricultural workers, United States Postal Service workers, manufacturing and grocery store workers, public transit workers, as well as those who work in the educational sector, so teachers, school support staff, and daycare workers. Phase 1C will be in early spring. This will include all people aged 65 to 74 years and older, regardless of whether or not they have any underlying health conditions, and people who are aged 16 to 64 who have a certain one or more of certain underlying health conditions that would put them at higher risk for severe disease. And that list of those certain health conditions is determined based on the science and data is produced by the CDC. In addition, other essential workers who were not vaccinated in 1B will be vaccinated in 1C. And the ACIP gives some examples of those, such as people who work in transportation and logistics, food service, housing construction, finance, information technology, communications, energy, law, media, public safety, and then the public health staff who are non-frontline healthcare workers. Phase 2 will begin, we anticipate, in late spring and continue through the summer into the fall. And it will include all people who want to be vaccinated who haven't previously had the opportunity or done so. The ages of people who it will be recommended for will be per the guidance from the ACIP. Currently, one vaccine is recommended for down to age 18 and the other one down to age 16, but neither are recommended for children at this time. It is important to recognize that this is that rapidly evolving event that we keep mentioning. This vaccine is unlike any vaccine that the world has ever dealt with before. So we do have to remain flexible in our response so that we can continue to respond to those global and local challenges as they arise. This includes understanding that many of our hospitals are facing unprecedented stress on their systems right now. We're currently working to expand the number of individuals who are qualified to administer the vaccine, including working with LLR to explore possibilities for retired nurses, students in their last year of nursing school, and also DHEC is looking at EMTs. Paramedics have already been authorized, if indicated by their local medical control, to vaccinate. As more individuals are brought on board, we will keep sharing that information with you. Thank you and stay safe. Christy, back to you.
Thank you, Dr. Traxler. We appreciate that update. At this point, let's move right into our questions. And the first question that I have for today is, who should private healthcare employees and anyone else in phase 1 contact to receive the vaccine? And does DHEC have a list of contacts to share with them?
So currently they should contact their local hospital. And a list of contacts is on our DHEC website and will continue to be updated in addition as additional providers are brought on. And that will be available at scdhec.gov/vaxfacts, VAXFACTS.
And what measures have been taken to ensure that no one in phase 1A misses the opportunity to receive the vaccine?
So vaccinations do not have to be received by the phase 1A members by January 15th, but they do have to have requested that first dose appointment before then. Therefore, communicating that deadline out to all phase 1A members is how to prevent those members missing the opportunity. Communication is going to be blasted out by our partners at LLR to all of their licensees that are in that phase 1A groups. And we're also going to be working with professional associations to share that information. In addition, you all, as our valuable communication partners, can help share this word as well.
And is it accurate to say that DHEC had a policy in place that prohibited hospitals from vaccinating any non-employees before January 1st, which prevented hospitals from vaccinating those phase 1A individuals in the community? And if that's true, why was that direction given?
So DHEC has always provided guidance for phase 1A. We did clarify that guidance this previous Thursday or Friday. The days do start to run together. So that clarified guidance, we hope, helps hospitals to understand that they are allowed to vaccinate phase 1A members outside of their system, and that we actually do encourage it.
Okay. Under what circumstances or scenarios would it be possible for a South Carolina resident age 75 or older to receive the vaccine in North Carolina as part of its phase 1B instead of waiting for South Carolina to move to its phase 1B?
So North Carolina would be making decisions about whom they will vaccinate and when they will be doing so. So that would be up to that state.
What is DHEC's response to the governor's timetable announced yesterday? And secondly, is the agency prepared to make the transition to phase 1B on January 16th?
So DHEC, as I noted in my points, had met with the governor on Monday afternoon. And so we are prepared to make a transition if needed, and to evaluate really is the most important thing. The demand for appointments and what appears to be the number of phase 1A members who have or have not been requesting appointments by January 15th to make that decision. But we'll be prepared whichever direction is necessary to go on January 16th.
The governor said yesterday that the bottleneck of vaccine administration is partly due to confusion over who's eligible, and said these categories are going to be clarified and broadened. What does that mean? And have there been any changes in eligibility this week, and what sort of clarity has DHEC provided? And lastly, what is DHEC's reaction to his comments?
Sure. So we did update the list of the guidance document for phase 1A. just on our website earlier today. We do want to note that the list of Phase 1A members on there may not be all inclusive, but we are continuing to add members as the Vaccine Advisory Committee reviews and recommends that certain groups be added. And so it is broadened and clarified, being a little bit more explicit about naming specific groups rather than broader categories.
Thank you. Stephen, this set of questions is for you. What's the latest number of approved providers for the COVID-19 vaccines in South Carolina? And secondly, who can become a vaccine provider? Could it be a veterinarian, a physical therapist?
Yeah, so we currently have 775 enrolled provider sites, which have been approved, and that's just as of a few minutes ago. And then the second question was, who can become a vaccine provider? In licensed individuals within their scope of practice on humans is the answer to that question. So as long as they can stay within their scope of practice on humans. Thank you.
Thank you, Stephen. It was previously stated by DHEC that the agency is exploring all options to meet the need for healthcare workers to administer the vaccine. What efforts have been made to tap into groups like the National Guard, emergency medical staff, and retired nurses to accelerate those efforts? Dr. Traxler?
Certainly, thank you. So we are looking into all different groups. As I noted in my talking points, we are having discussions with LLR, our colleagues there, and working to see what can be done and explore the options for retired nurses who have let their license potentially expire, as well as senior year nursing students and EMTs and potentially dentists. Those are all groups that we are exploring with LLR. We have authorized the state medical control physician and DHEC have authorized paramedics to vaccinate for COVID-19 if it's approved by their local medical control physician. And as I noted, we're exploring that for EMTs as well. The Board of Medical Examiners has provided guidance clarifying that COVID-19 vaccination can be performed using medical assistance. So we've shared that information when hospitals have inquired about that. And we also continue to remain in great partnership with the National Guard, who have been a huge assistance to us throughout this response with testing and helping in hospitals and vaccination. And so we are working with them to determine where they are needed the most and where they can best assist the state, because as I noted, they are still helping, we're with the testing plan for the state, as well as within some hospitals and various facilities helping them.
If someone receives the full vaccine, do they have immunity indefinitely, or must it be administered again in the future?
So the answer for that is to be determined. There are still studies being conducted. They are still following those same people that were part of the clinical trials for phase 3 that were the ones that they were able to prove that these are safe and effective on. They are studying the longevity of the effects on them. And so we will know more information in the coming months.
Thank you. Stephen, this question is for you. How many people are estimated to be in phase 1A in South Carolina, and how is DHEC tracking or confirming when we hit the target of offering the vaccine to 70% of that population?
Yeah, so since the ACIP has provided their guidance and DHEC has expanded our guidance with phase 1A, we're estimating that there's around 350,000 individuals in the phase 1A. And we are tracking that, the doses that are administered in the federal system, which is the Vaccine Administration Management System, known as VAMS. In addition to looking at the doses that are administered, we're also looking at vaccine appointments as healthcare workers are reaching out to their provider and or hospital. And DHEC as a whole, we are continuing to monitor and report on these numbers on a daily basis. So we'll be reporting on that as we get closer to that threshold. Thank you.
And Christy, I'm sorry, I do want to note too that as the CDC guidance is evolving, DHEC guidance is evolving too, and so we're going to be looking at at a variety of variables and factors that the CDC is now recommending. And rather than focusing potentially on one specific number, we're going to be looking at the overall picture of supply versus demand and where that is.
We have several viewers asking about the impact of COVID-related dementia. Has DHEC compiled any data that speaks to this concern?
So we compile data on symptoms, but not necessarily secondary diagnoses such as a COVID-related dementia. So I am not aware necessarily of seeing any patterns in our data for symptoms that might suggest that, but we are not looking specifically at that, again, that secondary diagnosis.
Thank you. Stephen, have there been any reports of vaccine doses being wasted or spoiled due to temperature problems?
So we've actually seen very minimal wastage and or spoilage reported to our VAN system. We attribute a large part of this to the fact that the hospital systems that receive the ultra cold vaccines have the storage capabilities of being able to store those vaccines at those ultra cold temperatures, that negative 70 degrees Celsius. So we feel like that is a big contributing factor as why we've seen very little waste. But we do see waste that does occur. It's very typical with any vaccine that you get or that's given at a provider office. And so it's nothing new there as far as if somebody breaks a vial, et cetera. Thanks.
Dr. Traxler, do you know what will be the process for the next phase of vaccinations in South Carolina? For instance, will there be like an online sign up, drive-through, things like that?
Sure. So as we progress through these phases, we know that there's going to be increasing numbers of people in the phases needing to be vaccinated. And so we are looking at the operational components that will be involved in administering vaccination to that many people, while especially considering and taking into consideration the some of the unique characteristics of some of those groups for vaccination, such as the elderly or those with health conditions. So drive-through is a potential that is being explored. Though we are still looking at it in relation to the 15-minute observation period that's needed after receiving the vaccine. We are also looking at basically a scheduling type system, either online or by telephone or some hybrid thereof. And so as we get closer to phase 1B, we will be providing more information about the different options for how to arrange to get your vaccine, as well as specifically where to go to get your vaccine.
Can healthcare providers order vaccine from the vaccine manufacturer?
No. All of the vaccine at this time is being distributed by the federal government. This isn't just in South Carolina, this is across the country. All of the vaccine that's basically allotted for the United States or that the United States has access to is being distributed by the federal government.
Stephen, this is a two-part question for you. The first part is, according to the CDC, South Carolina has been shipped approximately 28 doses per 1,000 people. The average is around 46 per 1,000. The median is as well. And this puts South Carolina 51st in the nation out of 50 states and DC. Is South Carolina ordering its full weekly allocation of doses?
Yeah, so as we've mentioned in past briefings, the doses that we have received in South Carolina have been ordered against in its entirety. Those doses are very limited. The Moderna doses have gone to the long-term care facility partnerships. We with our current allocation that we have with Moderna, we anticipate getting those doses out to providers next week, to the ones that we're onboarding outside of the acute care hospitals. And then the Pfizer doses have been allocated to the acute care hospitals and non-acute care hospitals as well. And we'll be allocating some additional Pfizer doses next week to some providers out in the community outside of the hospitals as well that have ultra cold storage capabilities. Thank you.
Dr. Traxler, are you aware of any prominent state leaders or government officials who have been vaccinated, and are they included in any of the phases?
I am not aware of any, of the state governmental officials or leadership being vaccinated, though certainly if they were in 1A, they absolutely, would be eligible to go ahead and be vaccinated. And we would encourage it, at least for them to schedule their appointment by January 15th. Everyone will be in one of the phases, including state government leadership, but they will be in phases in general based on their own physical characteristics, their age or health conditions, or depending on what aspect of leadership or state government. They may be in one of the frontline essential workers or the essential worker category, as I named earlier, some of the other state agencies and the like. Thanks.
Stephen, this is for you. Could we get more information on the 14,625 doses received by the DHEC Distribution Center as compared to the 5,882 doses as of yesterday that have been distributed to hospital sites? Why is such a large number being retained at the DHEC Distribution Center?
Sure. So the DHEC Distribution Center is routinely sending out doses from that center to smaller sites which can't handle a full order of the minimum ordering quantities of 975 doses from Pfizer. So DHEC is acting on behalf of some of these facilities, and on a daily basis, these doses are being distributed from that site to those smaller sites in smaller quantities, one that's more manageable, where they can strategically vaccinate individuals that they're looking to vaccinate within a 5-day window. So as we bring on additional sites, and as smaller sites are ordered or being onboarded rather, DHEC will distribute doses to those sites as well from the distribution center.
Dr. Traxler, I know you've spoken to this already, but should all people await notification that are now eligible for vaccination, or can those who haven't been contacted but believe they are eligible or will soon be eligible due to things such as age, profession, pre-existing condition, should they reach out to healthcare providers to confirm their status or schedule a vaccination appointment?
Sure. So right now, the healthcare workers and those who work in healthcare settings are strongly encouraged to reach out to their local hospital, or as we bring on, as Stephen noted, non-hospital sites in the next week or two, to reach out to them. We strongly encourage them to make that appointment for their first dose by January 15th, even if they have not been contacted, to go ahead and initiate reaching out. However, if you are not a healthcare worker at this time, then there is no need to call a healthcare provider or hospital. There's not a sign-up list per se at this time for people in future phases. And we will be communicating, again, the exact specifics of how to sign up for an appointment as we get closer to the next phase starting, so that people will have an opportunity and will not miss that.
And I think this is probably going to be our last question. When will the Vaccine Advisory Committee be releasing the finalized guidance for Phase 1B and Phase 1C?
Certainly. So my understanding is, I believe they were meeting again today, is that they hope to have more information today. My understanding again is that they are in overall agreement with the Phase 1B and C categories that the ACIP has put out, but are looking at some of the detailed aspects of those groups now. And again, I anticipate that they'll be getting us more written information to us and recommendations here in the next week.
We'd just like to thank all of our media partners, Dr. Traxler and Stephen White, for joining today. Did just want to clarify one thing. The list of hospital contacts and the vaccine flow in South Carolina infographic will be updated online this afternoon. And just want to again thank you for joining, and until next time, stay healthy.